Hi, this is Jonathan Gold. I'm a pediatrician and physician informaticist. One of the things that I find fascinating in medical informatics is capturing temporality. Temporality is a key point that we look at when we're reviewing a patient's file. And today I want to talk about what might be rules around temporality for capturing it within free text, and that using natural language processing, what would be those rules that we could use to guide large language models? So by way of introduction, incorporation of temporality into analytics and modeling fill a critical gap in the interpretation of data, precursors, outcomes, related events. Not only can they augment phenotypic associations for patients, which are necessary for life sciences initiatives and other health studies, but time is key to deriving meaningful links between medical treatment and health outcomes, and for constructing advanced decision support systems. Precision medicine that lacks clear timelines is, simply put, not all that precise. Predictive modeling can only determine a pattern when temporal relationships capture intervals in sequencing. With the estimated 80% of data in a patient's medical record entered as free text, our inability to tap information contained in that narrative leaves a substantial gap in the data we can utilize for analytics. Providing consistent rules for large language models, LLMs, based on accepted inferred temporal phrase meaning can guide natural language processing to achieve an acceptable degree of precision in interpreting clinical note text. The inclusion of text note temporality can inform and support the construction of predictive modeling. Construction of these LLM rules provides inference modeling for time in medicine. So I want to talk a little bit about what temporal phrases are. Now, I'm really a horrible note taker as a physician. A patient may come in and say something to me like, "Hey doc, I've experienced headaches, but that was some time ago." And I write that down. So you might say I'm a good note taker. But then as I'm checking the patient, I realize I don't really know what that some time ago means. And I'll say, what did you mean? What's some time ago? How far back is it? The reason why I say I'm a bad note taker is because I never updated what that patient has told me. The patient told me it was 4 months ago. That's what was meant. But I never changed that in the record. So I know there's a temporal piece to this when the headaches occurred, but I don't know the next time I look at these notes, or if someone else looks at these notes, when that occurred. One of the things that we do is we can say, well, interpretable temporal phrases are not good enough. We need something that we can plot, we can quantify and interpret when something actually happened. What's that specific point in time, or what's that specific range in time? Unstructured data is everywhere in the patient record. So we have structured fields, and those are things like date of birth, very specific things, current medications, etc. And we have free text, which is probably close to 80% of the text that we look at. Let's define what an event actually is. And what about those LLMs anyway? I mean, can those help us? We're going to talk about what inference modeling and usage we might make of that free text. So what's an event? Basically, there are two required components to an event, and there's one additional piece that might be added depending on what that event is. So an event can be broken down into an entity and temporality, entity being a problem, a diagnosis, a procedure, a lab, an order, etc. Like lung cancer, appendectomy, blood glucose reading, or blood glucose order, and others. Temporality will talk about what's the sequence of something. How long did it last? When did it occur? What was the age of the patient when something happened? Spatiality talks about where something might have happened, or anatomy. So for instance, if we talk about hypertension for the past 20 years, I don't really need that spatiality piece. If I talk about exposure to radiation and I add the temporal piece 14 days after the explosion at Chernobyl, we have some idea of what's going on. So exposure to radiation 14 days after the explosion at Chernobyl. When we add the spatiality piece, which is living 50 kilometers from the site of the explosion, we have a really scary event. Okay, so we have exposure to radiation 14 days after the explosion, living 50 kilometers from the site of the explosion. What happens if we change that spatiality to 5,000 kilometers from the site of the explosion? It's relatively a non-event. So spatiality does have a role. We're not going to pursue that in this talk, though, today. Let's talk about syntax in general, temporal syntax. So we have something called definitions, and those are higher order rules. Those refer to the general structure, the syntax, the semantics of what we're trying to capture, that temporality. There are smaller pieces. There are parts of speech that we look at, and those are similar to what we would call parts of speech in any given language. They're used for parsing out that temporal phrase. Sometimes we can put a few of these parts of speech together, and that becomes a pre-coordinated phrase. We like to try to deconstruct that phrase, that event, into those parts of speech or that pre-coordinated phrase along with that entity. Pre-coordinated phrases and the synonyms of those pre-coordinated phrases are pretty important because then we can link them to a conversion formula. Conversion formulae allow me to say that when something happened 3 months prior to when I put this entry in, or 3 months ago, I can take off, say, 90 days from the current date of that entry, and I can figure that out. I can write that up as a mathematical formula. This is a very concentrated graphic, and you will have access to the documents related to this talk, and I will let you know at the end of the talk how you can get to a link to see this. Basically, it's saying that there are certain parts of speech that are important. When those parts of speech are combined, you can come up with a pre-coordinated phrase, but sometimes you just have to parse things out which don't allow for combination to get to a pre-coordinated phrase. A value is something that is like a cardinal number or an ordinal number, 1, 2, 3, first, second, third. A measurement is a unit, a measurement unit or a phase or an age. So it can be something like month, year, day, or a phase like trimester, or an age, years old. A measurement unit for age would be years old, months old, days old. Tense, past, current, future, etc. Recurrency and frequency. Well, recurrency there can be an event that's non-recurrent, like splenectomy. There can be a regular recurrency, once every 2 weeks, or there can be variable recurrency, every so often, 4 times a month, etc. And there are other pieces like duration. Was this a momentary event? Child fell out of a treehouse. Or was it something that is a span of time, hypertension for the last 20 years? How certain is this information? Well, doc, I may have had mumps as a kid, but I'm really not sure. Or is it something that's definite? I'm very sure that I received all of my childhood vaccines. Mode is sort of a potpourri of other things. It can be sequential, it can be priority, it can add certain words, and we can talk about that elsewhere. So the instruction set, the components of the instruction set that we want to give to the LLM come from 4 different areas. There are definitions, there are rules, there are commands, and then there's that presentation or display piece. So definitions, as I said, those are higher order. So measurement, for example, measurement narrative refers to a time unit, a phase, or an age scale. That's a definition. A rule actually takes that information and becomes much more granular. Lower delimiter will always be the earlier date or the earlier age. There are rounding rules for standard measurement units. For instance, we are always going to try to round to the nearest day when we're talking about standard measurement units. We'll look for upper and lower limits if those are relevant. There are rules for common phrases. What does it mean when someone says, when I was a kid, this happened? So we have those types of rules that we need to include. Additionally, there are very clear-cut commands that we want to give the LLM. First, identify and mark that event phrase, okay? Capture both the temporality and that associated entity. Secondly, code that entity. So if it is a diagnosis, you might want to use SNOMED CT, or you might want to use ICD-10. If it is a lab, you'll use a blank. If it's a med, it's RxArm, procedure, CPT. There are many different ways of coding things. Then you want to parse the phrase using those definitions and rules to determine what's that related event temporality, and determine the date and age when that event occurred, and then how do we want to display that. When we're talking about presentation or display, we're talking about what is the temporal element we want to show. Do we want to show age? Do we want to show date? Do we want to show both? It really depends on what that use case is. There are many different formats for displaying the event. So there are three different perspectives of temporality that I want to talk about right now. There's a biographic view of temporal events, and that's basically the patient's age at the time. There's something called differential, so it's event A occurred and then event B. What is the time difference between that when we determined this occurred and that occurred? And there's something called extrinsic, which actually just ties us into the date of when something occurred. We're going to look at all three of these. What I've pulled up right now is basically a patient timeline, a health timeline, and it has, if you can see, it has the patient's age, event 1, 2, 3. It doesn't really matter what that event was, what the entity was, and then it has dates associated with it. So when we talk about biographic perspective, this is really important, and it's related to the age of the patient. These are all in days. I tend to use days just when we're looking at things, and then I convert it back to years, months, days. I'm a pediatrician, so I think in terms of days, at least for the first 30 of them. The biographic perspective is utilized particularly to look at identifying patients with similar disease patterns, and these are really, really important for predictive modeling. So if I have two patients who have very, very similar backgrounds and similar health events at the relatively similar ages, then I can say maybe one can serve as a model for the younger one. The older one can serve as a model for the younger one, and I can see what the progression is of the disease. If I introduce drug A or drug B, I can say, I can have an idea of how that might affect a patient like this. Differential is actually captures different events. For instance, I might want to know what's the time between when I have a diagnosis of diabetes mellitus type 2 and the onset of stage 1 chronic kidney disease. It's a way of looking between two different events and trying to learn a pattern. The third are includes extrinsic dates. These dates help me put a patient's events in perspective, particularly in light of public health events. For instance, if we are talking about someone having a tuna fish sandwich with really bad mayonnaise at Joe's Bar and Grill, it doesn't matter what their age is, because I probably have 14 other cases during that day of people who had that spoiled tuna fish sandwich at Joe's Bar and Grill. So now I can say on this date, whether the person was 7 or 70, this occurred. Another example, which is more recently came to the fore, is the pandemic spread of COVID, and where we were really looking at when the dates were, what was the spread in a region. So this is the Grand Master picture showing biographic, differential, and extrinsic. And you're probably scratching your head and saying, well, that was really cool. So where do we go with this? you might want to be a bit more explicit when you're explaining what you're talking about with the temporality and how to put those rules together. There are a bunch of rule categories that I've put up here, and there are more than these, but these are the ones that I want to touch on during this talk, at least. In general, we talk about things that are concepts. A concept should be associated or shall be associated with one and only one part of speech. Compound phrases will be used to supersede. Those are the ones that use multiple parts of speech to express a phrase. For instance, we might have something that's made up of 4 or 5 different phrases, words, 2 or 4 months ago. So a compound phrase might be 4 months, or it might be that pre-coordinated phrase 4 months ago. Pre-coordinated is a type of compound phrase. We'll typically try to find if there's a pre-coordinated phrase hidden. We'll try to use that again because we can associate a conversion formula for that. That doesn't always work. Sometimes we only have a compound phrase and we need to have the LLM help us find what those points in time are. Note dates, and I should actually call this metadata. Note dates are very important because they give us some sort of anchor. So if something happened 5 years ago, I've got the date stamp of entry and I can figure out what is the equivalent of 5 years ago as far as the patient's age, as far as the date, etc. So you use that as captured. It also includes things like the date of the procedure, date of birth. Those are types of metadata that are very important for us. Parts of speech we spoke about, and I'm not going to go further with that, but there are those parts of speech that we do parse the phrase to. Sometimes in free text, we do receive fully defined dates. So an event occurred on May 4th, 1967. I can just use that as captured, and I can convert that either to the patient's age or plot it on a timeline. Often, though, we'll get partially defined dates, like July 1989, cholecystectomy, July 1989, or myocardial infarction, 2003. Then we actually need to take those dates and figure out, well, how do we work with that? July 1989 is a general, it's not a point-specific time. I can't say this is the date. So we do grab something which we call point in time. And in this case, July 1989, it's that midpoint, the middle day of that month. By convention, we say it's the 15th, even though it could be the 16th. By convention, we call it the 15th day of the month of July. So it's July 15th, 1989. But we do have a lower delimiter, which would be July 1st, and an upper delimiter, July 31st. And that way we can actually grab a range that's pretty close to when something occurred. It may have occurred actually on the July 7th, but I've got that piece of information. It's a much clearer piece than just saying it occurred in 2003. By the way, for 2003, we would grab the middle day of the year. That's July 2nd. I know this because I've studied it. July 2nd, 2003. And the first day would be January 1st. The last day would be December 31st. Ranges follow the same rules for start and end dates. There are, commonly we say there's past, present, future, or past, current, and future when we talk about tense. So tense, we take the date stamp of entry and it's minus a certain number of days. In the future, it's the date stamp of entry plus a number of days into the future. Often, though, we have things that are continuous. So past to current would be patient received up till today Tylenol, received for the last week up until today Tylenol twice a day. Or past to future. Patient began chemotherapy 2 weeks ago, will continue for the next month and a half. Current to future. Starting today, the patient will be on a regimen of low carbohydrate diet. There are also tensed intervals. So that means that I have a tense, like the word ago, a value, like the word 3, and a measurement unit, like months. So 3 months ago is a tensed interval, and it's a type of pre-coordinated phrase. What is a point in time? That's when we have a specific date or age, and we always try to reach out and get a point in time, even though we know it might not be the exact time when the event occurred, it's our best approximation of when it occurred based upon the text that we have. And it's used as that most definitive point. Upper and lower limits or upper and lower delimiters allow us to put in, for lack of a better phrase, a fudge factor. It allows us to say, the person said it happened at this point, but we know it's probably close to it, but it might be a little bit higher, a little bit lower. So what we do is we actually take half of that measurement unit, and that's what we say is what we're going to use as a plus or minus and that we're going to add to that point in time that we've derived. So, for instance, if the patient says this occurred 2 weeks ago, and the date stamp of entry was April 3rd, 2022, we know that the measurement unit was a week. Therefore, we're going to have to take whatever we derive as our point in time and add or subtract 3.5 days. So that point in time is the date stamp of entry minus the equivalent of 2 weeks ago. That's 14 days. In this case, it's March 20th, 2022. The lower delimiter, we're going to take March 20th, 2022 and subtract 3.5 days. By convention, we round it to the number. So we end up with March 16th, 2022. And an upper delimiter, which is to take that date stamp of entry minus the 14 days plus 3.5 days. So it's date stamp of entry minus 10.5 days. That gives us March 24th, 2022. Here's a simpler graphic. So we've got that date stamp of entry on April 3rd, 2022. We were able to find that point in time that was the March 20th, 2022. We said plus and minus that 3.5 days. There are a bunch of other phrases that we sometimes need to capture. Doc, I've had this for more than 2 weeks. It occurred more than 2 weeks ago. Or in the last 2 weeks, these things occurred. So we have upper and lower delimiters, even though we might not have a point in time, a specific point in time that we would look at. This is, again, a look at that patient health timeline I threw onto the screen a little while ago. You can see, for instance, where we might want to include those delimiters. So while specific points in time can be used to identify the beginning and end of events or intervals, delimiters, the upper and lower range, are included to capture that degree of uncertainty when converting text interpretations. Here you can see the chronic kidney disease stage 2 to chronic kidney disease stage 3, but the graphic shows it fades out going below it and going above it. That captures, in at least graphically, what that assumed likelihood is. There are different types of measurement units. We have standard measurement units. Typically, we'll try to convert things to days, but the standard timeline units are days, weeks, months, years, decades. It can be a century. There are brief spans of time that are really critical in medicine. Milliseconds if we're measuring EKGs, for instance, or seconds. The patient lost consciousness for seconds or minutes. The patient ingested something hours ago, X hours ago. So there are multiple measurement units, but for timelines, we typically will convert everything into days. And of course, there are ranges that we need to talk about. So I'm a chronic liar when I go to see my doctor. I always lie to her. She'll say, "How long have you had this?" And I'll say, "Oh, 3 to 5 months. It's been at least 3 to 5 months." I have no idea. It could very well have been 4 months ago. It could very well have been less than 3 months, but that's what I'll say. It's 3 to 5 months ago. It's just the nature of the beast. When we're trying to report when something happened, usually we feel more comfortable giving a range because we're not really sure. So what do you do with that range? How do you add that? One of the things that you need to do to add is, first of all, the measurement unit was months, so it's plus or minus 15 days to whatever we come up with. But we are also going to say, well, 4 months ago is the equivalent of, let's say, 120 days. So it's the date stamp of entry minus 120 days. That's our point in time. There's that lower delimiter, which was that 5 months ago, and I'm going to take off an additional 15 days. And then there's that upper delimiter that was 3 months ago, and I'm going to add 15 days. So in other words, my range is going to be 165 days ago to 75 days ago, and I can generate a date from that. There are things that we call tethered phrases, medical milestones like postoperative day, POD, sequential periods of time, next year, last month. There are relative things like early next year. And all of these require us to have certain rules about how do we interpret something that was early next year. Well, early next year means it was at least in the first half of next year. And the middle of that would be March. So it might be from January 1st to June 30th, with the middle being March 1st, or I'm saying that incorrectly, but in March. There are other things that are commonly written in the medical record, like last Christmas the patient had. On the 4th of July, patient was lighting fireworks and held it too long. Or there are physiological stages, like first trimester, second trimester, and common expressions of time, like when I was a kid. There are also life cycle dates that we can often capture either in structured text or in free text and convert them. This list is going to show up on the next slide. It will be in italics. These are the pieces that you need when you're deconstructing a temporal event, an event. So the phrase lower back pain began 2 weeks ago. That's the flag text that we would investigate. The metadata anchor, in this case, we would say was April 3rd, 2022. That's when it was written into the record. The entity that we're capturing, that lower back pain, is a problem. So this epsilon looking thing is actually means entity, or this is an entity of. It just means it's a set. It's a member of the set of. So lower back pain is a member of the set of problems, which is a member of the set of entities. Began is a member of mode. To is a value. Weeks fits into measurement. Ago fits into tense. There are certain syntax rules that we use, and ultimately we get to where we spoke about before with deriving those dates. How will we display it? We can either display this as a list, or we can do it graphically. It really depends on what our expectation is, what our use case is here. Just to wrap up, the inclusion of text and note temporality can inform and support the construction of predictive modeling. Construction of these LLM rules provides inference modeling for time in medicine. Providing consistent rules for LLMs based on accepted inferred temporal phrase meaning can guide natural language processing to achieve an acceptable degree of precision in interpreting clinical note text. The LLM instruction set for time should include definitions, rules, commands, and presentation display components. I want to thank you. My contact information is here. For access to a white paper, it's actually a blog, and it has other lectures about temporality and spatiality. But to get access to more information, much more in-depth information, you can look at that last line that says timespacemedicine.wixsite.com/time-space-medicine. That will give you more information going forward. Thank you for your time today.